In gastrointestinal disorders, Agni plays a central role. According to Ayurveda, the strength and balance of Agni determine proper digestion, metabolism, and overall health. In every gastrointestinal case, the physician must assess whether Agni is Manda, Tikshna, Vishama, or Sama. Conditions like Ama, Vidagdha Ahara, and Vishama Ahara should always be considered. Malabandha is a classical symptom of Ama, and therefore bowel habits and dietary history must be carefully inquired in every patient. Major disorders such as Arshas, Grahani, Udara, and Javra begin with impairment of Agni. Hence, Agni Dusty is the root cause of most metabolic and digestive disorders. Depending on the condition, Dipana, Pakana, Anulomana, and Malashodhana should be employed appropriately. When Agni is disturbed at the Dhatu level, it leads to Dhatupaka, which can be correlated with autoimmune and chronic inflammatory conditions in modern medicine. Acid reflux, Gerd, gastroesophageal reflux disease, is defined as the backward flow of stomach contents into the esophagus. The most common symptom is heartburn, felt behind the sternum, which may radiate to the neck, throat, and even the face. This condition commonly occurs in individuals who consume outside or hotel food, overeat, and sleep immediately after meals. Symptoms worsen when the patient lies down. Obesity is a major contributing factor. Repeated exposure of the esophagus to gastric acid can cause chronic irritation and inflammation. In rare cases, it may lead to a precancerous condition known as Barrett's esophagus. If untreated, narrowing of the esophagus may occur. An Ayurvedic physician must be aware of these complications. Diagnosis. In early stages, acid reflux can be diagnosed clinically. If there is no improvement after 6 months of treatment, endoscopy is advised. Endoscopic biopsy may be required in selected patients, especially those above 40 years of age with weight loss. From an Ayurvedic perspective, this condition is considered Pittaja Udavarta, where the Tikshna and Sneha Guna of Pitta are increased. Treatment principles. The main principle of treatment is Pitta Shamana, with Tikta Rasa dominance. Amapachana is done for Pitta, along with Vata Anulomana. Since Madhura Rasa is Snigdha, it is avoided in the initial phase of treatment. First phase, Kashaya Prayoga. Guduchyadi Kashaya is administered 60 milliliters twice daily before food. In patients with Agnimandya and Shleshma Prasheka, Ruksha Tikta Aushadhis are preferred. Other useful formulations include Patola Nimba Kashaya, Triphala Aragvada Kashaya, and combinations of Triphala, Nimba, Yashtimadhu, Katukarohini, and Aragvada. Grita Yogas. After 2 weeks of Kashaya therapy, Grita preparations are selected based on local dosha involvement. Indukanta Grita is useful in upper GI gastritis and kapha dominance. Mahatiktaka Grita is ideal for pitta shamana and duodenitis. Dadimadi Grita helps in vata anulomana and lower bowel disorders. The usual dose is 15 milliliters before or in between meals. Other shamana aushadhis, Bhaskara Lavana and Narikela Lavana with Pravala Pishti are given with buttermilk. Pravala Pankamrita, with Datri Loha, ghee, and honey, is effective. Since honey and ghee are not used in equal quantity, this combination is not virudha and acts as vranaropana. Kalyanaka Gulam is administered at bedtime for Sukha Virechana. Shankha Basma is especially useful in acidity. Second phase, Draksadi, Murdvikadi, Madhuyashtiyadi, or Vidaryadi Kashaya may be used based on the clinical condition. Leha preparations. Shatavari Leha is preferred for